What are ventilator allocation protocols in public health? Have you ever wondered how hospitals decide who gets a ventilator when there are not enough to go around? This is where ventilator allocation protocols come into play. These structured guidelines are essential during public health emergencies, like pandemics, to help healthcare providers make tough choices about distributing mechanical ventilators. When demand exceeds supply, these protocols aim to ensure that allocation is fair, ethical, and transparent. They are built on key medical ethics principles that guide healthcare today. One of these principles is justice, which means ensuring that everyone has equal access to ventilators, regardless of race, disability, or socioeconomic status. Another principle is beneficence, which focuses on doing good for patients. This means prioritizing those who are most likely to benefit from ventilator support, specifically those with the highest chance of survival. Nonmaleficence is also important, as it emphasizes avoiding harm. This means not providing ventilator support if it is unlikely to improve a patient's outcome. Respect for persons is another key principle. This involves considering patients' values and wishes. However, during a crisis, protocols may allow for withdrawing ventilators from patients unlikely to survive, even if this goes against family wishes. This can create ethical challenges that are difficult to navigate. Ventilator allocation protocols often categorize patients based on clinical criteria. For instance, patients may be grouped by the severity of their illness and their likelihood of survival. Some protocols use clinical scoring systems, like the Sequential Organ Failure Assessment Score, to estimate mortality risk and guide prioritization. Exclusion criteria are also part of these protocols. Some patients with very low chances of survival or severe comorbidities may be excluded, but blanket exclusions are generally avoided to respect individual assessments. When patients have similar priority scores, tie-breaking mechanisms may come into play. These can include additional criteria like age or even lotteries to decide who receives a ventilator. Some protocols propose time-limited trials, offering ventilator support for a specific period to see if a patient meets clinical milestones indicating likely benefit. If not, the ventilator may be withdrawn to help others with better prognoses. This approach balances care with maximizing lives saved. It is important to note that different regions may have varying ventilator allocation guidelines. This can lead to differences in scoring systems, age considerations, and how comorbidities are handled. Such variations can impact equity and consistency in public health responses. Implementing these protocols requires legal and ethical support, especially when withdrawing ventilators against patient or family wishes. This legal backing helps protect clinicians from liability and maintains public trust. During pandemics, hospitals relying on these protocols to make transparent and consistent decisions under crisis standards of care. They aim to save the most lives while respecting ethical principles. By standardizing criteria across facilities, these protocols also discourage hospital shopping, where patients seek care at different locations for more favorable allocation. In essence, ventilator allocation protocols in public health are designed to guide the fair and effective distribution of limited ventilators during emergencies. They balance the goals of maximizing survival, respecting individuals, and maintaining fairness in healthcare.